Hello, my name is Elyse Couch and I am a PhD student at King's College London. I'm really excited to share my presentation with you titled Can an Early Diagnosis of Dementia Help People to Live Longer? A Study of Electronic Healthcare Records. So why diagnose dementia early? UK dementia policy has really highlighted the benefits of diagnosing dementia early, stating that an early diagnosis can improve quality of life, prevent unnecessary admission into care home or A&E. However, when Alzheimer's Disease International reviewed the benefits of an early diagnosis in 2011, they found that many of the paper they reviewed in the course of their systematic review contained statements regarding the benefits of early diagnosis. Many of these statements were unreferenced, and where references were provided, these were generally to other papers making similar non-evidence-based assertions. These statements should therefore be considered at best to represent expert opinion. In my research, I wanted to understand further what are the benefits of diagnosing dementia early, and mild cognitive impairment is considered to be a prodrome to dementia and can aid with the earlier diagnosis of dementia. So in this study, we decided to use a previous diagnosis of mild cognitive impairment before a diagnosis of dementia as a proxy for early diagnosis. And this way, we were able to investigate the relationship between an early diagnosis of dementia and mortality. We conducted a retrospective cohort study using electronic healthcare records from South London and Maudsley NHS. We included all patients over the age of 50 who were diagnosed between January 2008 and November 2018. And we divided these participants into two groups, those with a previous diagnosis of mild cognitive impairment, an early diagnosis, and those who were without. And we used COGS regression models to compare the risk of mortality between the groups. So we had 18,555 patients included in this study, and of these patients, 5.6% had a previous diagnosis of MCI and therefore an early diagnosis. These participants with an early diagnosis were more likely to be white. They had fewer problems with cognition, fewer psychiatric symptoms, and less impaired activities of daily living at dementia diagnosis, increasing the validity of using this method to measure early diagnosis. In addition to this, a greater proportion of participants with an early diagnosis were prescribed anti-dementia medications after their diagnosis. People with an early diagnosis had a lower risk of mortality, as shown in this graph. However, this effect was non-significant when using the MMSE to adjust for cognition. From this study, we concluded that a diagnosis of mild cognitive impairment before dementia can be used as a proxy for early diagnosis. This is a replicable method and can be used to look at other outcomes. In this study, an early diagnosis was associated with a reduced risk of mortality. However, the strength of this association did vary by which measure was used to adjust for cognition. So while this is promising, we can't be conclusive on the relationship between an early diagnosis of dementia and mortality, but this is a start. And if you want to know more about this study, the full paper will soon be available in the Journal of Alzheimer's Disease. Thank you.